Bismillahirrahmanirrahim. Assalamualaikum and good morning to Madam Rehina Binti Abu Bakar. Today we are presenting for our Assessment 1 graph presentation for subject code LCC402 English for oral presenting. Our topic discussion today is depression among unemployment. We choose this topic because it's very critical in our societies today. Especially as many people are affected by economic instability. Through this analysis, we also use the data which in this chart is credible as it is collected from reliable sources. Before we begin to our analysis, let's introduce ourselves for this pair work. My name is Shazwanie binti Shamsul.
And I have joined as a partner. My name is NURALISA ALIAH binti NOORAZAHISHAM.
Alright. Next. To begin, mental health issues, particularly depression, have become a major concern in our modern society. While many factors contribute to this condition, the stability of one's employment status is often a primary indicator of psychological well-being. So to make it simplified, our research is focused on how the stability of a person's employment status act as a primary indicator of their psychological well-being. Essentially, we are looking at how much job security and the lack of it will shape the aspect of person's mental health. So here we move on to the purpose. Our purpose is to identify youth with no income as the primary demographic for assessing the impact of unemployment on depression, and to classify the severity of depression symptoms among unemployed young adults, specifically within the GTO zone. So to support our analysis today, we have been utilized two types distinct of graphical representation, which is firstly pie chart and secondly bar chart, and each of it have different aspect on our topic today. Next. So here we will see the definition. According to World Health Organization 2023, depression is a mood disorder that involves a persistent feelings of sadness and loss of interest and can affect how a person thinks, feels, and behaves. So, due to this, having a stable employment becomes a significantly harder for a person which is having a trouble performing their duties. So, next information I will pass to my partner, NURALISA.
Thank you, Shazwanie. Next, I'm going to talk about factors of depression. Depression can be caused by several factors. These include brain chemistry imbalance, genetics, and stressful life events such as loss or trauma. It also can be linked to a medical condition as well as certain medications, alcohol, or drug use. Next is I'm going to explain the effects of depression in daily life. In terms of its effect, depression can impact daily life in many ways. First is emotionally. People may feel sad, hopeless, and lose interest in any activities that they are doing. Second is mentally. They may experience poor focus and negative thoughts. And third is physically. It can also cause fatigue, sleep problems, and changes in appetite. Fourth is socially. Individuals may withdraw themselves from others, lose motivations, and perform poorly in any daily task that they are doing. However, in some serious cases, it also can lead to a serious self-harm and a lower quality of life. And for the next slide, I'm going to pass it to Shazwanie back.
Alright, thank you, Alisa. Right now, let's analyze for the first graph, which is highlights the diverse profile of 6,400 Malaysian youth aged by 15 to 30 surveyed by UNICEF Malaysia for the My Youth Mental Health Index 2023 report, which ensuring a representative sample balance. So next. So here I already zoom in so that clearer to see. We can see that from the segment in the green area, which represent 46.46% have no income, when we can add 35.01%, which is below than 2,500 ringgit Malaysia of income, it reveals that over 80% of youth are in vulnerable financial position. Regarding to the analysis, we can conclude that income gap, which becomes significant contributor to the mental health gap. Having no income, which is not just about money, it's also about loss of purpose and also constant survival stress. This is exactly where the cycle of depression begins for unemployed demographic. This figure is vital for presentation because it is highlights for economic vulnerability of nearly half of the youth population. This lack of financial stability is the primary stressful life event that triggers the cycle of depression that we are discussing. It is the connection between the financial struggle and mental health decline. So next, I will pass to NURALISA for further analysis graph.
Thank you, Shazwanie. Next is I'm going to explain that building directly on the economic vulnerability that Shazwanie just mentioned earlier. Let's take a look at this bar graph on the slide. It was taken from the research paper by Mokona and the other in 2020. It illustrates the severity levels of depression among unemployed young adults in Gidio Zone, Southern Ethiopia. And the graph title is Depression's Severity Level Among Unemployed Young Adults Living in Gidio Zone, Southern Ethiopia 2020. It shows that on the bar graph, more than half of the affected individuals, which is 56.70%, experience mild depression. In comparison, 36% of the participants suffer from moderate depression, while only a small proportion 7.30% are classified as having severe depression, which represent the most critical cases in our study. This figure show that unemployment is a major issue, especially among young adults in Gidio Zone, Southern Ethiopia. Due to limited job opportunities, financial problems, and social pressure, many individuals may feel hopeless, sad, and having a low self-esteem. Due to the emotional stress caused by the depression, many people may rely on substances such as alcohol, cigarettes, and drugs as a coping mechanism. Based on a research paper by Mokona 2020, which is a drug that is widely available in Ethiopia, which contributes to its higher use, especially among individuals that are facing emotional stress. However, we could see that there is a clear relationships between unemployment, depression, and substance use, where depression often pushes individuals towards substance use, and the cycle can make their conditions even worse. And we have come to the last slide, which is the conclusions. That we can conclude our presentation for today that the cycle of depression and unemployment is a straightening battle. The loss of professional identity and financial stability results in profound psychological pain. This pain also can create a barrier that often prevents individuals from successfully re-entering the workforce. Let's conclude our presentation for today. Thank you to Madam for listening to our presentations, and that's all from us. Thank you, Madam.
Thank you, Madam.